Thanks for joining us for the daily update. First of all, we have 3,397 cases of coronavirus in Victoria. That's 288 more than our last update. There's been some reconciliations, but that's the net number. 47 Victorians are in hospital, 12 are in intensive care. Of those 288 cases, and given the size of that number, the magnitude of that number, there's still the vast majority that are still being investigated by our public health team, but 26 of those are connected to contained and known outbreaks. 262 of those are still under investigation by our public health team. Those numbers will jump around a bit. There'll be linkages back to other cases, but again, that detective work has to be done first. Now, can I just highlight what I think is an equally significant number in terms of the daily update? We did 37,588 tests yesterday. That is the biggest single day of testing that has been done, and by some considerable margin. When you're looking that much, then that's the exact strategy. You're finding cases of the virus and you're able then to do the contact tracing, to take steps to limit the movement, to isolate, to take all those necessary precautions to try and make sure that positive cases and close contacts are not moving around the community. They are in fact in their home. Now, I know that there will be great concern about these numbers. People will feel particularly concerned to see that number as high as it is. I just want to remind everybody that we've been very, very clear. We didn't take the step to return to staying at home, except for the 4 reasons for metropolitan Melbourne, because the numbers were stable. We didn't take that step because we didn't have a problem. We took that step because we knew it would need to get worse before it got better, and that unless we took those steps, we simply wouldn't be able to bring a sense of control to this. We would not be able to see a stabilisation and then a driving down of those case numbers. At the same time, no one should underestimate how significant, how big a challenge that we all face. It is very significant, and that's why each of us have to play our part. So I know and understand there'll be concern across the community to see that number. I just want everyone to acknowledge a couple of points. It was always going to get worse before it got better. We're doing more testing than has ever been done, and not by a small margin, but by a massive margin. I'm very grateful to everybody who has participated in that testing program, and I would urge all Victorians follow the rules. And if you have symptoms, even mild symptoms, please come forward and get tested. That gives us the most powerful tool, a sense of where the virus is, how it is moving, and how it is we can best respond to it. Beyond that, I just want to make some quick announcements, and I'll ask Brett to add to my comments both on the epidemiology of the day and also the announcement in relation to masks. As you know, there's been for some time now, there's been a bit of debate about at what point masks become important. We think we're at a stage now, and the advice to me from the Chief Health Officer, and it's supported by AHPPC, it's supported by others, is that through an abundance of caution, through the fact that it's relatively easy, we should request of all Victorians when they are out of their home, and this relates principally to metropolitan Melbourne and Mitchell Shire, when you're out of your home for one of those 4 permitted reasons, and where you can't maintain that 1.5 metre social distance, so whether you're in an Uber or a taxi, or if you're on public transport, or many other examples, even shopping for the basics you need when you need them, either a homemade mask or another mask, and I'll come to that in a moment. It is our request of you. It's not compulsory. We're simply asking that if you can wear a mask where you can't distance, that's exactly what we would like you to do. That's a relatively small contribution, but one that can make a really big difference. Brett will speak a little bit more about the science behind this and how it is that the sorts of benefits we think that might come from this. To that end, we have, because this is not something that's going to be for a week or even 6 weeks, I think masks in those circumstances where you can't maintain distance will be a feature of our response to the pandemic for the foreseeable future, maybe many, many months. So it's not a matter of urgency, it's a matter that now's the time to move to that. Now's the time to do that common sense thing To that end, we've already begun the process of getting 2 million reusable masks made, and we will be able to then distribute those throughout the community. And in the interim, that takes a little bit of time. But again, this is not something that's a week or a month. It's going to be with us for quite some time, and we think it'll be perhaps even more important on the other side of this lockdown, as it is now. We'll also, in the interim, provide up to 1 million additional single-use masks. And I'll have more to say about how we're going to distribute those, how they'll be available. I think there are some priority groups that probably will receive those masks, those single-use masks in the first instance. There's many single-use masks that are being used now. For instance, some of the different communities we've been talking about in recent days, for instance, public housing tenants. We think that might be, there already are some masks being used there, but we might be able to take a further step in that particular environment. There'll be lots of examples like that. That's not to say that we should be compelling people. That's not to say that if you're wearing a mask, you're doing the wrong thing. We just need to be all conscious, to work together, to be as respectful of each other as we can be. It's a small thing, but our request, not an obligation, but our request is that if you are out in metropolitan Melbourne or Mitchell Shire for a lawful purpose, and you don't think you're going to be able to maintain that 1.5 metre distance in a cab, in an Uber, on public transport, maybe at the shopping centre if things were quite busy, then we would ask that you wear a mask. And it can be a homemade mask, and I think Brett will even talk to scarves and things of that nature. No mask, even surgical grade, reduces the risk of infection to zero. There's always some inherent risk. That's why it's still so important. If you're unwell, if you have symptoms, then you shouldn't be out, let alone out shopping or going about your business, even if that would be within the 4 reasons. It's really important that anybody who's sick, the only reason to leave your home is to get tested, and for no other reason until you get the results of those tests. So I appreciate and understand that there will be a sense of concern seeing those numbers. The sheer volume of testing that we're doing, I'm comforted by that. That is a massive number of tests. To get those taken and to get them processed, it means you will find more virus, because we know the virus is out there across metropolitan Melbourne. The key point here, though, is to acknowledge that these numbers will need to increase. They'll need to get to a peak before it is we can stabilise them and drive them down. And the best and most appropriate response to these numbers is for all of us, our public health team, to keep working hard, and they will, thousands of them, working day and night. And secondly, the best response to these numbers and the worst numbers that are likely to follow them is for all Victorians to play their part. I know it's not easy. I know that it's not pleasant. I know it's very frustrating, and we'd all like this to be over, but we cannot ignore the reality of the circumstances we face. And if each of us work together, we'll be able to get to the other side of this, and we'll be able to begin that opening up again. Now, I might ask Brett now to speak to the numbers and the science of this, the public health of this, and speak a little bit more about masks. And then I'm going to ask the Chief Commissioner, who's joined us here today, just to speak a little bit about the Victoria Police activities that are going on in partnership with the ADF and others, and also speak to you about some of the behaviour that we've seen in recent days. Whereas many are doing the right thing, there are some quite stunning examples of people doing the wrong thing, and I want the Chief Commissioner to share those with you as well. So over to the Chief Health Officer.
Thank you, Premier. Yeah, certainly 288 new cases today is a pretty ugly number. We have talked about the fact that we would expect an increase in numbers over time, and that there was no room for complacency at any point in time. That's as true today as it's been right up until now. But the effect of the lockdown will really only be seen in the numbers in the next 1 to 2 weeks. So we may well get worse numbers to follow. There is absolutely reassurance in the level of testing that we're doing, because in finding those cases they can be identified and they will isolate. Their close contacts will be contacted and will be in quarantine. But it is an indication of the transmission that was occurring a week ago that's showing up in the numbers today, and we may well see it worsen before it gets better. We know that there are continuing hotspots in the northwest corridor in particular. Of recent days, there's been an uptick, especially in Roxburgh Park and Craigieburn and Truganina. So there are some postcodes that are really significantly showing up in terms of transmission. So people in those areas in particular should bear in mind that any symptoms really should prompt you to be testing, but that is true across Victoria. But in those postcodes in particular, those suburbs, people really need to have an awareness that if they've got symptoms, this may well be coronavirus. You should not be seeing other people. You should be at home. You should be isolating and getting tested. With respect to masks, really up until the last couple of weeks, there was ambivalent evidence and there weren't really strong recommendations coming out in Australia in relation to them. A big Lancet meta-analysis, so a study of a number of other studies' data, has really shown that masks do make a significant difference potentially. Even understanding that people don't always wear them perfectly, that they don't provide perfect protection, but when they're worn very broadly across a population where people can't distance that 1.5 metres, they can make a difference. They can reduce transmission by up to 2/3. That's a really important additional measure, and when we're trying to do absolutely everything in Victoria to drive transmission down, it's a really important additional tool. And so in those settings where you might be in close proximity with others, public transport, taxis, Ubers, shopping for food, shopping for other goods, essential goods, visiting your GP, these are really important times to wear a mask, especially when you know that somebody has to be in closer proximity to you because you need to be there and you can't distance effectively. Of course, all other circumstances that are not essential, you should be home. That's what the stay-at-home directions are. And wearing a mask is no substitute for keeping that distance from people, isolating when you're unwell and getting tested. The numbers that we're seeing at the moment are of concern, but we do expect them to plateau in the next week. But it requires everyone to follow the stay-at-home directions. Those 4 reasons to leave home are really the only reasons to leave home. Don't look for excuses, don't look for ways around. Live to the spirit and the law of those 4 reasons, because that's what will get us through this.
Good afternoon. I just want to give an update in relation to our extension of Operation Sentinel, specifically the vehicle checkpoints and what we're doing about that, as well as some of our enforcement activities over the past couple of days. We've already established the 7 strategic checkpoints, if you like, around metropolitan Melbourne that we said we would. They've been active since these newest restrictions have came in. And we're also in the process of activating and progressing another 2 checkpoints near Heathcote and Avenel, and so they'll be up very soon as well in relation to the Mitchell Shire. We've seen, since we've started recording the data, we've intercepted over 5,500 vehicles over that period of time. And from those checkpoints, we have seen a number of, if you like, infringements issued. There's been around 12 at this stage. We're still collating the data, but 12 infringements from those checkpoints. We've seen another lot of infringements also issued. Over 60 we've issued in the past 24 hours, so a significant increase in our enforcement. And there's a couple of matters that I'll speak to shortly, but several examples that are very concerning. There were 16 infringements given out in one single incident, and I'll speak to that in a moment, at a birthday party. There are another 4 given out to sex workers as well, and as well as a, if you like, an attempt to breach the checkpoint and get to a country area. So we, in addition to those checkpoints though, those strategic ones that will be permanent and running, we're also going to be having right around metropolitan Melbourne, and people have been seeing these since we previously ran Operation Sanus, active rolling checkpoints right across the state. And when we've heard the terminology, you know, every police vehicle is a booze bus, well, every police vehicle is involved in COVID-19 enforcement. That is a fact. That's happening right across the state and will continue. I said the other day we'll be ramping up our enforcement where people aren't complying. By and large, people are doing the right thing, but we still are seeing numbers and incidents where they're not. And so those couple of incidents I've just spoken to, I'll give a bit more detail about them because they go to the root of our concerns. If you like, the birthday party I just mentioned, we had some ambos who were at a KFC out Dandenong, and while they're getting something to eat, they saw two people in there, and they're ordering 20-odd meals at 1:30 this morning. And so they spoke to the people at KFC. Subsequently, there was a report made to us. We got the registration number of that car, and we followed through and went to that address in Dandenong. It was a townhouse. When we went in, there were two people asleep in there, but there were 16 others hiding out the back, and they just got these KFC meals at a birthday. That is absolutely ridiculous, that type of behaviour. And, you know, it's a very expensive night when you think, apart from the KFC, we've issued 16 infringements at that amount. That's $26,000 that birthday party's costing them. That's a heck of a birthday party to recall, and I'll remember that one for a long time. I make this point that there are consequences. In Glen Waverley, we had a report through Crime Stoppers where there was a large amount of men frequenting an address, going in and out. Subsequently, we had our sex industry coordination unit attend, and there were 4 sex workers in there. They were on a break when we attended. They've all been issued infringements. So there's a range of just totally unacceptable behaviour that's occurring. We also had, at 1:30 this morning, a couple from Docklands who drove their car, tried to get through a vehicle checkpoint at Lang Lang. They were turned away and warned. They did so at Longwarry just a short time later. We knew they were trying to get through. They were trying to get through to a holiday house down Phillip Island. They were issued with infringements, or the driver was, and the passenger is to receive an infringement as well. So this type of conduct, this type of blatant, obvious, deliberate disregard for the Chief Health Officer's guidelines, we will be enforcing. We'll continue to do that. And we saw yesterday, as quite reported in the media, whale watching down Mornington Way. Totally unacceptable, total breach of the distancing rules, arguable whether it's even exercise full stop or there's a reason to be there. That conduct won't be permitted. We will continue to enforce, and as I said, if the public don't comply, we'll continue to ramp up our infringement issue, and it's as simple as that. So the warning is, there are consequences. We said we would be increasing our enforcement. We are. And there are a range of issues as well over the city last night where there were parties we were called to, people who were drunk and out and about. I expect to see those infringement numbers rise from those parties and things like that. It's finished. The time for that is done, and we will continue to issue the infringements to make people comply. In terms of the ADF, they will be and are now assisting us. There's about 30 of them on the ground now. We expect another 130 tomorrow to be assisting us at vehicle checkpoints, a range of logistics and planning type issues, and we welcome their assistance and will continue to work with them. We'll be using, as I've said before, automatic number plate recognition, all of our resources, our highway patrols, our general duties, our specialists, a whole range of different avenues and resources, but we will be out there, we will be patrolling, and we will be enforcing. And can I just send a thank you to the public? Generally speaking, most of them have been compliant. It's only these selfish behaviours we're seeing from a few, but we will, for those few who don't want to comply, we will make them. Thank you.
Of course, the other point to make, just following Shane's description of some of that behaviour, if we see that behaviour continue, then all of Melbourne will not be locked down for 6 weeks. We'll be locked down for much longer than that. So I'd appeal to every single Victorian, if we all play our part, then we can, despite the challenging nature of these numbers and the understandable concern that will be there in the Victorian community, it was always going to get worse before it got better. The one way to bring some stability to those numbers, arguably the only way to bring stability to those numbers, is for all of us to stay at home except for those permitted reasons to leave, and then only to leave when you need to. The 4 reasons are not an invitation to leave home. They are reasonable excuses, reasonable terms on which you would leave home. It's not an invitation to go shopping for things that you don't need, to be doing things that you really don't need to do. That's why the rules are there, to try to do everything we can to limit the spread of this virus. I don't want our city shut down for a moment longer than it needs to be. If people follow the rules, then we have a much greater chance of being able to bring stability to these numbers. Logic tells you that, the science tells you that, the advice from the Chief Health Officer is we're all working as hard as we can, but every one of us has got a part to play in that. I know it is not easy. I know it is challenging. I know that none of us wanted to be in this position, but we simply don't have the luxury of ignoring the reality that we all face. On masks, we'll have more to say in coming days about the orders we've placed. I think Brett's going to do a video and some guidance material to people on how to make your own mask. Any level of protection, if you can't keep that 1.5 metres, is better than none, and that's why it's an advisory, it's a request, it's not mandatory, but it's just another example of everyone playing their part, trying to do everything we possibly can to limit the number of cases and to limit the spread of this. We're happy to take any questions you've got.
Will you order any masks from the national stockpile, and are they available now?
They would be, but I don't think we're going to need to go to the national stockpile. We've got our own reserves, and there are others on order to replace any that we might use while we're waiting for those that might be used now while we've got the production of reusable masks. Again, this is not compulsory, it's not across the board. We do encourage it, we'd very much like people to do it, but it won't be relevant for every person, and it's not relevant in every set of circumstances. For instance, in your own home, unless you were specifically advised to protect a vulnerable person in your home, for instance, then you wouldn't be wearing them in your own home. If you're out for daily exercise and you think that you can keep your distance, then you need not wear it. You might choose to, just as an extra thing that you might do, an extra important contribution that you might make. But if you're getting into a cab or you're getting onto a train or a tram, going to work, for instance, which is one of the reasons to leave home, and you think that there's a chance you might not be able to keep your distance, then even a homemade mask will be of some benefit to you, to your family, to your suburb, to your community, indeed to all of us.
Given the number of cases we've got out there at the moment, or I guess the number of recent cases we've seen in aged care facilities,
Yes.
Are you considering any changes to the regulations or requirements around, say, visiting there?
No, I think the advice at this stage remains consistent, that we've got good protocols in place in terms of aged care, good rules, solid processes in terms of who can and can't go and visit, and if we have an outbreak, that notion of locking down that aged care facility for the protection of those residents, all of whom really are vulnerable in one way or another. If advice to make changes there was to come forward, then of course we would change it.
The sector's asking for a change to protocols so that any residents who test positive are transported to hospital for treatment rather than being treated potentially at the facility.
Again, I'm sure that request and any number of other requests that have been made over the last 6 months by that sector will be properly considered by our public health team. And given that there could be a national issue with that as well, I'm sure AHPPC would look at it too. But I'm not briefed in any way that there is going to be a change. If there is a change in advice, though, then we'll be the first. We'll be telling you, and we'll be telling the Victorian community.
How do you see the federal inquiry?
Sorry, Nick.
How do you see the federal inquiry into the hotel quarantine working with the state inquiry? And do you think it shows a lack of confidence in the state inquiry that the federal government has initiated its own?
No, because it's a national inquiry, and the one that we're having is looking back. This is a prospective, if you like, double checking of arrangements in place right across the country. So I don't think that they're linked in any way. I did take the opportunity today, and it was acknowledged by my national cabinet colleagues that we will not be taking flights for the foreseeable future, and those flights will need to be diverted to other capital cities. And I'm not sure whether the Prime Minister went to that today, but we have enough to do at the moment, and given that we've had the better part of 20,000 return travellers processed here, many of whom were not from Victoria, I think it's fair to say, okay, others are going to have to deal with that issue because we've got our own set of challenges that we have to deal with, contact tracing, all of those important things.
How many close contacts are we dealing with? And given that we've now got more than 1,000 active cases, do we even have enough contact tracers to deal with this and to track down every close contact?
Contact tracing is always a challenge. It is a difficult, laborious, really challenging task, no matter how many close contacts you have, even a small number. I think our team is equal to it, but we're growing that team. It's now bigger than it's ever been, and I'll have more to say quite soon about additional resources, additional support to expand that team even further. And again, Rachel, that's not just because of the circumstances we face now, but if we're going to keep a lid on things, even very small numbers of cases in regional Victoria, then we're going to have to do even more. And if we're going to bring not just stability to these numbers, but that continual reduction over the 6-week period, and if we want to maximise the likelihood that it is just the 6 weeks and not a longer period, of course we're always looking to add to that team of coronavirus detectives. They do a fantastic job. It's a bigger squad than it's ever been. But will it need to get bigger again? I think as our challenge gets bigger, yes.
What training have those people all had?
The entire team.
Yeah, I mean, there's a suggestion that other states have teams that are more professional rather than, you know, being students who've done quick courses.
I wouldn't accept that criticism. I'm not sure anyone's put in their name to that criticism, actually. I think that might be just some reporting, and that's part of the job that you guys all do. I'm proud of our public health team. Are they all working night and day? Yes. Are they all doing their very, very best? Yes. Will the team get bigger again? Yes, it will, because that's what needs to be done. I'm very confident in all of them, from their leadership all the way down to the newest member of that team. They're all working day and night to bring stability to these numbers and then to drive these numbers down. That's the most important work.
These sources have confirmed that Victorian health officials didn't adhere to national guidelines for contact tracing, and that specify that close contacts should be followed up daily for flu-like symptoms. Why didn't that happen? Are close contacts being followed up daily now, and what training have they had?
I don't accept the criticism, and I certainly, the notion that something's been confirmed by an unnamed person who won't put their name to it. This is a matter of public health and science. Let's try and be as evidence-based as we can. I reckon that'll serve us well. If someone wants to put their name to that criticism, then maybe we could have a discussion about it. But I'm not here to talk about unnamed sources. Ultimately, our public health team, it's a bigger team than it's ever been. They are always looking to do more and better in changing and dynamic circumstances. There is a good culture in there, very high skill level, very high work ethic. Is there a need for us to go further? Is there a need to respond to the data we receive every day? Of course there is. It's bigger than it's ever been. I can't rule out, in fact I'm foreshadowing that it's going to get bigger still. That's a really important part of this.
So are close contacts being followed up?
I would leave it to the Chief Medical Officer to follow up on that matter. Again, the public health team are doing the very best they can, and I think that, some may want to be critical, some may think that the best response during a pandemic is to provide, to be an unnamed source in an article. I'm focused on other things, frankly.
Has the national government offered support for the contact tracing team? Is that where some of that number might grow?
Well, I think it's important to acknowledge, I think we've kind of covered this a little bit over the last week, but again, I'm happy to go through it, and we can probably get you a detailed breakdown, actually. I had it for the purposes of National Cabinet this morning to thank individual First Ministers. I don't have it in front of me now. But just as we've got many staff supporting us from the ADF, we've also got very experienced public health physicians, very experienced contact tracers who would in effect play kind of leadership roles to lead a team of people. We've got many, many people from different parts of the country that are supporting us in both processing tests, making telephone calls, leading teams of people who are making telephone calls, sending emails, sending text messages, right the way through. Every part of the response is being supported by other states and territories, not unlike arrangements we all put in place when we've got a bushfire on. I'm very grateful to them, and I took the opportunity this morning to thank each and every one of them for the different contributions they're making. And just to make the point that it is a true national effort, we've got the ADF, obviously, that from the federal government, and we've got Tassie doing 200 or 300 tests a day for us, because that's the amount of capacity that they can give us. So it's a true national effort, and I'm very grateful to everybody involved in it.
Premier, have you considered putting in harder lockdowns and restrictions in those 3 suburbs that were named earlier as sort of hotspots, if you like?
No, I think, Rich, the most effective measure, and the advice to me from our public health team, is the stay-at-home order with those 4 reasons to leave, noting, of course, that the exercise reason, you are not allowed to leave metropolitan Melbourne. So if you're in Craigieburn, for instance, you're not allowed to go outside the metropolitan area and Mitchell Shire, and we'd ask you to do daily exercise in the spirit of limiting your contact with others. So it's not an opportunity to go and run a marathon or to go and travel 3 hours away from home. It's a walk. It's getting out, getting some fresh air. It's daily, but that doesn't mean it's all day. It's just common sense is a really important part of that, and I'm sure people will follow that. If circumstances were to change in any given postcode, we'd always reserve the right to go further. Just like I have to be really clear with people, we can't guarantee that this ends in 6 weeks. All we can do is appeal to people. Let me put it this way. All we can do is work as hard as we possibly can with the biggest and best team we can possibly assemble, and I'm very confident about both the work rate and the quality of the people that are doing this work. Beyond that, all I can do is appeal to Victorians to play their part, and sometimes it's small things, sometimes I am asking a lot of Victorians. But if we all work together and play our part, we're much more likely to get to the end of the 6 weeks having achieved our aim, stability and less case numbers, and this thing being back under control, and we're also more likely to have not had to take extra measures in given suburbs between now and then.
President, the thinking's changed on masks. Are you now considering, given what's happening with this outbreak and the expense, are you coming around to the idea that maybe going for elimination might be worth considering?
We remain, as part of a national cabinet process, pursuing a strategy that suppresses this virus. I think that if you were to go for the World Health WHO well-defined strategy where you have eliminated the virus, then that is a very different set of arrangements. That is not potentially a lockdown for 6 weeks. It could be much, much more than that. If, however, as a result of the suppression strategy, you can achieve 0 cases for a long period of time and have a degree of confidence that you have beaten the thing, then that's a fantastic outcome. There are some states that have been able to achieve that. They never had community transmission to start with, and that I think is part of why they've been able to get to that point. We're about delivering the strategy, and that is bringing this back under a sense of control. That's what suppression's about. If we can go beyond that, well, that would be a good byproduct, but the notion of a 3 cycles, so many weeks, and indeed beyond weeks, where you had 0 cases, that'll mean an entirely different set of policies and an entirely greater level of hardship in order to deliver that.
So we're starting to see, as the virus spreads, some pretty significant businesses have it appear amongst their workers. There's a chemist warehouse, there's a significant supermarket in Melbourne's west. Now, they're not closing down. I spoke to the manager of the supermarket. He said, well, the advice from the department was that we didn't need to, and in fact that they're doing their own contact tracing because the department contact tracers haven't got out there yet. Does that sound right to you? Because there are staff in that supermarket who are pretty concerned, and also in the chemist warehouse distribution centre.
I couldn't comment on an individual outbreak. I'm happy to come back to you and get some details. Obviously, an employer has usually got employee details much more readily available than what anybody in the public health team would have, and if people can be contacted really quickly, regardless of who is contacting them, to say, listen, you may be a close contact, please stay at home, you'll be contacted by others at a point soon, that's a fantastic thing. We're all in it together, and if we can all play a part in that, then all the better.
Is this illness, for Brent, if you wouldn't mind coming up?
Sure.
Brent, if that's okay. Is this illness still being mild in most Victorian cases? I've noticed the hospital number spike. Can you just give us some observations on that?
Yeah, certainly the virus is the same. It's as dangerous as it ever was. It's not mutating to be more or less dangerous. But who gets infected manifests in hospital. And who we're seeing in hospital at the moment are the most vulnerable. The ICU numbers have gone up significantly. The hospitalised numbers have gone up significantly. That usually lags the increase in numbers by a week or 2 as people develop the worst manifestations of the illness. And we will see an increase in hospitalised and ICU cases and in deaths in coming days because of the spike that we've seen in numbers in recent days. But it's not because the virus is worse. It's because we're seeing people who are most vulnerable, the elderly, those with chronic illness, coming down with infection. And it's not just for them to protect themselves, it's for all of us to do the right thing to stop the transmission in the community that puts these vulnerable individuals at risk.
How many healthcare workers are...
How are our ICU wards placed to cope with that expected increase?
Yeah, look, they're dealing with it within their usual capacity, but it's a not insignificant number to have 12 in ICU, even in distributed ICU network in Melbourne, but it's certainly within their capacity. But we have to bear in mind that we need to turn this around, because there are places in the world that are about to be overwhelmed in their ICU capacity. Texas and Arizona and Florida are right on the edge in that regard. Our numbers are the numbers that the US gets every 10 minutes. So we are still in a fortunate position, and we have gone to a lockdown at this juncture in order not to have those kind of pressures manifest in our system.
How many healthcare workers are in isolation at the moment?
I don't think masks are really feasible in schools. Kids can't wear masks necessarily in the same way that adults can. Teachers can't really teach with masks, but I think everyone in schools should feel free to bring a mask if they feel comfortable with it. Teachers in the common room, or individual students if they so choose.
So if masks are being provided to hospitals as a priority, is that also aged care facilities and disability care?
Aged care is a Commonwealth responsibility, and they've supplied personal protective equipment to aged care. Again, it's a recommendation, it's not a mandatory requirement. So I think we'll continue to work with the aged care sector around how they might best manage risk. But at the moment, the cases that we're seeing in aged care are in staff. They're testing very early, they're being identified. It's not spreading to residents, or it's spreading to one resident. We're not getting outbreaks because we've got a really early and robust response in aged care settings. But again, if those individual staff want to make their own mask, they're certainly free to do so.
And how many close contacts are you now dealing with?
It's over 5,000 close contacts. It's a big number. The national guidelines say that where feasible, everyone should get a phone call every day. That means where feasible. But what does happen in Victoria is that everyone gets an automated message. The app provides them a link. They get a prompt about needing to quarantine. They get a prompt every day about whether they've developed symptoms. And if they develop symptoms and they are flagging that they have, they're prompted to test. So the work for close contacts is being done. And we are now at daily levels that were similar to the peak in Australia. So it's stretching contact tracing activities, but they are, for contact tracers, it's a relatively routine business to check in with those in quarantine, to make sure they haven't developed symptoms, and to make sure they're adhering to the quarantine requirements. The real work is done in the long form interview with cases. We've got very professional individuals in the team doing that to identify all of the close contacts, all of the potential sensitive settings that those individuals go to. That's a much more specialised workforce, and we've got that workforce, and they're doing a fantastic job.
Are you able to break down the numbers in those workforces? How many do you have in the team who are dealing with the infectious people? How many are dealing with close contacts? How many are Victorians and how many are interstate?
Not at hand. I don't have all of the numbers for our team. The vast majority would be the contact tracers who can do that daily check-in. The specialised workforce you cannot manifest overnight. These are people who have gained the experience of doing communicable disease follow-up over years and years in our public health team. They are training others to do similar work, but it's not something where you can grab someone and give them a 5-minute rundown to do one of those detailed interviews. It's a very skilled activity.
So how many people are part of that specialised workforce?
It would amount to dozens, but again, I'd have to give you a formal breakdown later.
So when the government's previously talked about having 1,000 contact tracers, does that includes these dozens, but we don't have 1,000 people with those skills, obviously? No,
for interviews we don't need 1,000 people, but we've certainly beefed up across the entire workforce. So we're working on the interview skill set. We're ramping up the contact tracing activities. We're ramping up the team supervisors and managers.
Can you just pick up on the large businesses, the large organisations where they've picked up one or more cases? Why would they not close down until the DHHS contact tracing can be done, given that if you leave it to the company, they have an interest in staying open?
So they would be given advice about whether they need to close or not. When we get a case in a sensitive setting, we determine whether they have been infectious while they've worked there. If they haven't been infectious while they've worked there, then they haven't spread it to anyone there. They might have acquired it there, and so that business is prompted to do the testing amongst other staff to make sure that they haven't got other staff who are infectious there. If we identify staff who are infectious there, who've worked while infectious there, then it needs a different approach. But not every place that has a case who happens to work there requires closure. It really does depend whether they've been infectious at work, whether they might have acquired it at work, or neither, and they just happen to be at that workforce.
Do you have a definable tipping point where we need to go harder in particular areas? Is there an actual tipping point where you will look at the figures and say, either particular areas or around Melbourne, we have to go to stage 4 of grade stage?
There's no easily definable next stage for clamping down even harder. We absolutely have to see how these restrictions play out, understanding that there'll be a delay in the numbers, but it is under review every day. It really does depend whether it's a broad growth in numbers or whether it's an area where we just need to focus testing and communication and engagement. So no one number will necessarily be the decision point for harder lockdown.
And surely a return to face-to-face learning is unthinkable at the moment, given those numbers.
I don't know that it's unthinkable. I think we would need to see a turnaround in numbers to be happy. Again, through the whole of the first wave, I said I needed to be satisfied that we had sufficient suppression of community transmission to be happy that school can occur. That really applies now.
Given what you've said, though, that you're anticipating even worse numbers to come in the coming days, it doesn't sound like we're going to see that turnaround in time for face-to-face learning to resume at the end of the extended school.
Yeah, we are working on a preparedness to have remote learning as required. We have to bear that in mind.
What about these students coming back on Monday? We had 58 cases in students so far. It may end up being more linked to our toddler. You've said they won't be wearing face masks when they're back at school on Monday. Is that really a good idea?
So students coming back will have all of the requirements embedded in those schools as they return. The focus on making sure that anyone with the mildest of illness doesn't turn up is the key one. The distancing that they can do, understanding that school classrooms can't allow for 1.5 metre distancing for all students all of the time is a reality, but they'll do that to the extent that they can. Temperature screening will be a part of checking for all students. That temperature screen is not just checking for temperatures, it is a prompt for all students that they shouldn't be turning up if they've got symptoms, and they will be sent home. They are the key interventions for kids returning to school. The fact that it'll only be potentially Year 11 and 12 students means that the pressures on public transport and the pressures of gathering en route to school won't be so great.
Is this outbreak out of control? This might be one better suited for the Premier, but would you declare it as being out of control?
I wouldn't, for a start. I mean, we are working on controlling this. We know what works. We know it worked through our first wave, but it absolutely has to have people doing the right thing across the board. And so in a sense, it's in all of our hands. So I can't answer it definitively because it's not just for government and it's not just for those who write public health directions to bring it under control. It is for everyone to do the right thing in order for that to occur. And I guess the proof is in the pudding, and we haven't seen that yet, but we need to see it in coming days. But I think the early data about mobility, and we get mobility data from public transport from Facebook and other mobility data sets that are publicly available, tells us that people are doing much less movement around. That's a good sign.
You had 6 cases in Geelong yesterday. I hear there may be more today. You haven't locked down the Mornington Peninsula with 0 cases. You've got people commuting to both those areas daily from Melbourne. At what point do you need to think about closing Geelong down?
Yeah, we have to review Geelong on a daily basis. We need to know where those cases are occurring. If community transmission is established in Geelong, that would make the case stronger. But we also need to bear in mind how much the western suburbs of Melbourne have an increase in cases and how much commuting for work purposes, essential purposes, is coming from Geelong. I would certainly say to those in Geelong, you need to be as mindful of testing and symptoms as anywhere else in Victoria. And if you're commuting for essential purposes, especially to the western suburbs of Melbourne, bear in mind all of the things that you need to do to protect yourself. But yeah, we'll review the numbers every day in Geelong, and we'll investigate all of those cases to understand where they're picking it up.
Did the Premier actually, did you mention active cases? Do we have an active case number?
No, I don't think we have an active case number. It's over 1,000 at the moment.
And you don't have a specific number?
I don't have a specific number in front of me, no. I might do. 1,172 active cases.
How many healthcare workers are in isolation at the moment? I've heard reports that there could be hundreds. And what's being done, I guess, because there's probably going to be continual outbreaks in critical health infrastructure like emergency departments. What's being done to deal with the staff shortages?
Not my area to manage the staffing areas, but Safe Care Victoria, our Chief Medical Officer, Andrew Wilson, and our Deputy Secretary for Health and Wellbeing are all working across the surge requirements for workforces, but it's also something that individual health settings manage with their own rostering, with their agency and bank staff, and I know they're doing that. It is a challenge when you've got a number of health staff in quarantine because they're a contact of other positive staff. What we have done is rolled out masks universally in those health settings, so it's not just for ICU or emergency department work, it's for all of the clinical settings where health staff are doing that work. They need to bear in mind that they should also do it in their social interactions with other healthcare workers.
Do you know how many healthcare workers are in isolation?
No, not in isolation at the moment. We've got an increase in healthcare workers infected by 14 since yesterday. Again, that's a reflection of exposures a week ago. I hope that all healthcare workers are wearing masks in all settings where it's required. But it is the coalface. They are seeing those most likely to be carrying the virus. They are doing absolutely essential work, and it's dangerous work. And so it's not entirely unexpected that healthcare workers make up a proportion of our cases, but we want to do everything possible to protect them in that critical work.
Premier, will you accept any more ADF support on the ground over the coming weeks?
Last question, please.
I'd simply make the point that I've made detailed requests to the Prime Minister for ADF support. Some of those have arrived, others are on their way. It does take some time to stand up, particularly really specialist staff, people who've got those dedicated skills and experience to be able to help us. Very pleased with the response. If we need more, I'll certainly ask for more, and I'd be very confident, given the relationship and partnership I have with the PM, that the answer would be yes. That's a really important part of my job, and I'm very grateful that he joins me in fulfilling the responsibilities I have. Any other issues? Just finally, I'd say, this is a challenging day. It may get worse before it gets better, but we've got a plan and a strategy, and if we all work together, and if we all work hard, then we will get to the other side of this. But it's on all of us to play our part. And sometimes that's small things. For other people, they're making massive sacrifices. For every reason, please do the right thing this weekend. If we all moderate our behaviour, if we all stay at home, if we follow the rules, if we get tested when we're sick, if we don't go out and about our business as usual if we are sick, then we will pull this up. We will bring a sense of control to this. But it won't happen by accident, and it won't happen just because of luck. It'll be the contribution each of us make. That's what will deliver an effective strategy to suppress this, to control it, and to allow us to move to a COVID normal. Not normal, but a COVID normal. If you don't want restrictions to be on any longer than they need to be, if you want to get to that COVID normal as quickly and as safely as possible, then we've all got a part to play. Every single one of us. Let's make sure we're all vigilant this weekend and we're all playing our part. I know there will be thousands and thousands of people working 24/7 on our pandemic response. If all of the rest of Victoria play their part, then we'll be closer at the end of this weekend to the end of these stay-at-home orders. The alternative, of course, is that we put at risk all that progress that we hope to make. This is not a normal weekend. It really isn't. and I just appeal to everybody to play their part. If there's no other questions, thanks very much, everyone.